Hi, Dr. Houswirth. The question posed this week was, how will I work with the clients that have schizophrenia with religious delusions? And got me to thinking about how many people would be suffering with religious delusions that have schizophrenia. And in their 2008 article, Behafser and Bugra, they said about 36% of people with schizophrenia have religious delusions. And one of the things that has been kind of drilled into me from the beginning of my training here is establishing trust with a client is paramount. Unconditional positive regard. And that relates to God's word in Galatians 5:14. The law is fulfilled in this, to love your neighbor as yourself, and giving that person the love that you and respect that you would like goes a long way towards establishing a trusting relationship. In their 2010 article, Tandon, Nasrallah, and Kashavan talked about a few things to help people with schizophrenia, and one is to find the right antipsychotic medication for that person. Possibly electroconvulsive therapy was mentioned. Family intervention. And in our Goldenberg text in family therapy, it talks about that family intervention and how it decreases the expressed emotion and reduces relapse in patients that are returning from the hospital that have schizophrenia. The CBT, cognitive behavioral therapy, can help clients rationally appraise their experience of the symptoms of the disease, which with those with religious delusions, we'd need to kind of explore what their religious beliefs are, what distorted thinking that they might have with in regards to their religious beliefs. Cognitive remediation is another area to help the person to regain some of their cognitive ability, using strategies to help them organize information, and using environmental aids. And as I was looking online, there were other things like using technology that had like games for them to play and help build their cognitive functioning. And for those who didn't have a computer, there are also worksheets that you can use to help them improve their cognitive functioning. And then we have social skills training, and that's just the basics. That is to help them to learn how to maintain good hygiene. Also, maybe to help build some social skills, because there's a lack there. They might not know how to interact appropriately with the people around them. So social skills training and helping them to be able to communicate with people would be essential to help them to have normal functioning. And also, one of the things that they talked about was that there's a need for you to advocate for them in the community, finding positions, maybe jobs for them to have that they could function well at, and finding them even places to live that would be friendly or at least open to people who have this disease. You know, these are basic needs that they need. Maybe helping them to be able to get some services like food stamps and things like that. So there's just a whole holistic approach that you need to take. You need to not only take care of their emotional needs and mental needs, but maybe helping them to learn how to deal with their daily needs. God bless and have a wonderful day.